Let's talk about some myths when it comes to dental scaling and cleaning. I think the biggest one for me is when people ask me if scaling is going to scratch their enamel, and it doesn't. Sometimes they even say, oh, the last time I had a clean, I had my tooth broken. You have to remember that the scaler works with ultrasound. So it's basically vibrating only. It cannot physically drill into your tooth. So a dental scaling and cleaning cannot break your tooth, create gaps, or scratch your enamel if done correctly. And believe me, I would say anybody who's a registered dental professional would do it correctly because it's the simplest thing that they will teach us in universities. The second one, and an interesting one, is when people say, I don't do a dental clean because it creates gaps between my teeth. You have to think of it this way. Those gaps either already existed between your teeth, so you genuinely had gappy smile, teeth were a bit separated, which means you need to, if you want to bring them together, you have to talk to your dentist or orthodontist and use orthodontic treatment such as braces or Invisalign. Keeping calculus, buildup, germs, bacteria as a covering between your teeth is absolutely not advised, and to be fair, it's a little bit gross and non-hygienic. Secondly, maybe you didn't have those gaps, but you say, the first time I did a clean, it created a huge gap between my teeth, that's why I don't do a clean anymore. And believe me, this is a very valid question. It's so common, I hear it all the time. But why did dental cleaning create a gap between your teeth? How's that even possible? Did the dentist drill out a part of your gum or tooth or bone with dental cleaning? No. As I explained, the dental scaler or cleaning cannot create gaps between your teeth. Those gaps were created because you had so much germs and bacteria. It was first soft, created some plaque, then it hardened and calcified and had calculus in between your teeth. That calculus started eating through your bone, to put it in layman's term, and created a space between your gums and your tooth and filled that space with calculus and bad stuff. Basically, it has caused gum recession. Your gums gone down, created a gap. That gap is filled with calculus. So the first mistake was to have the dental cleaning way too late in your life. That's why you have that gap. Now, not cleaning it because that calculus makes it look nicer is absolutely wrong. You have to clean it because this is just gonna get worse. I've had a patient recently who asked me when I'm cleaning not to remove the big calculus between the two front lower teeth because she's going to a wedding and she doesn't want the gap to show. I understand the need to look nice and presentable, and the fact that you think that at least it's the same color as my teeth, it's a bit yellow, but it's fine, better than a big chunk of gap. But remember, that's just creating the gap more. You are creating a bigger and bigger gap by not getting a clean done. So have a clean. Make sure your gums are healthy. If you need to see a gum specialist, do so, and at least it will prevent the gap from getting bigger. To close the gap, talk to your dentist about the options that you have. Can dental cleaning prevent gum disease? It absolutely can. It's so easy. The germs from food and bacteria and our own natural good germs in the mouth all together create a pellicle and a plaque, soft deposit on your tooth surface. If you disturb that plaque, which is like a little ecosystem on its own, every 12 hours by brushing your teeth, basically it cannot grow further and further. But there are areas that you cannot clean properly, especially if you have crowding in your teeth. So that's when you have to every 6 months get a clean done to make sure you are disturbing that ecosystem, that biofilm, that calculus, and 6 months later, usually it comes back. Now, some people need it sooner. I have people who I have to ask my patients to come back every 3 months because they have active gum disease. Sometimes I cannot manage it and I have to send them to a periodontist who's a gum specialist, or sometimes they only need it once every 6 months to a year. So each person's mouth and also what they eat and genetics will determine how often you need a dental cleaning.